endocrine disorder model kit right here for the thyroid.
Thyroid.
It's pretty cool. You can take it. This is a normal thyroid gland. You can take it off, and you can add this big one. You see what your thyroid would be like if you had.
They say the future's electronic.
Hashimoto's disease, chronic lymphocytic thyroiditis. The most common cause of hypothyroidism lead to a reduction in the amount of thyroid hormones that the body produces.
What does the thyroid do? Wait.
The thyroid makes 3 hormones that you need. And they are T4 and T3, which are called thyroxine and triiodothyronine, and they regulate your metabolism. And then it also makes calcitonin, which lowers the blood calcium if you have too much blood calcium.
Where are you
It's
going?
stored in the bones. You can look at it, pass it around. So, the first disease that we talk about in this chapter is diabetes. You've heard of diabetes?
Yes.
There we go. Diabetes is from your pancreas. There are cells in your pancreas called islet cells. And this is showing a close-up of a little part of your pancreas. These cells in here are the ones that produce the hormones. And the hormones that are important for production are called insulin and glucagon. And for some reason, in some people, their own immune system destroyed all these cells that make insulin. Normally, the cell makes insulin and squirts it out and it gets into the bloodstream. But one by one, cell by cell, as the person with diabetes was developing in their mother's womb, every cell that produces insulin was destroyed.
Sheesh.
The white blood cells, for some reason, just singled them out and killed them. And then the person can't make insulin. That's diabetes. There's other forms of diabetes you get if you're older and you've eaten too much sugars over your life. You can get a different form.
Is that type 1 or type 2?
Type 2 is the one you develop when you're older. In both ways, your body's not responding to insulin. Or it's not, you're not either not producing insulin in type 1 or you're not responding to insulin in type 2. Either way, your blood sugar is out of control. And here's all the symptoms of diabetes. Lethargy, that's you're kind of lazy. Stupor, you can't think correctly. Weight loss. Hyperventilation. Your breath smells like acetone for some reason. Blurred vision. Nausea, vomiting, abdominal pain. Too much sugar in your urine. All these are problems with diabetes. Now, goiter is when your thyroid gland just grows bigger and bigger and bigger. It's often from an iodine insufficiency, not enough iodine in your diet. Your goiter doesn't know any better. It thinks your thyroid's not big enough. Your thyroid doesn't know any better, so it just grows and grows and becomes what's called a goiter. If you take iodine, it'll go back down, but it goes down. It grows slowly and it goes back down real slowly. You can get a tumor on your thyroid gland. There's the thyroid gland and there's a tumor. One of the models in the thing I'm passing around shows a thyroid tumor. Who has it?
I think I did.
You see it?
Yeah.
The thyroid tumor will produce too much thyroid hormone. What would happen if you're getting too much, what do you think the symptoms would be if you're getting too much thyroid hormone?
Losing weight.
Losing weight. We call it hyperthyroidism. And your metabolism picks up, you lose weight. That's one of the symptoms. There's a lot of symptoms, but that's one of them. People with thyroid tumors are usually real skinny. There's another disease called Cushing's disease or Cushing's syndrome, which is a problem of hypothyroidism. Do I have that right? Is anyone looking at this in their book? Mm-hmm. Hypothyroidism? Hypo means too low, not enough thyroid hormone. Look at all these things you can get from not enough thyroid hormone. This shows how important the thyroid hormones are. Muscle weakness, thin skin, acne, hair, stria, the stripes on your skin form. Increase of bone fractures, reproductive problems, blood pressure problems. Look at all the psychological problems. All this from not having a high enough metabolism. So, you want to see video footage? No. Cushing's disease?
Trotsky, a young, aspiring actress and model with stunning features and a love for the stage.
It's amazing. It's like it's a feeling of complete rapture.
But the picture changed for Conchetta, a disease, a mysterious one that took years to diagnose.
You're basically just like falling apart.
At 34, Conchetta was struck with severe fatigue, anxiety, vertigo, muscle pain, and she could barely speak at times.
The most challenging one, I think, was the speaking, because I'm such a communicative person and social relationships are so important.
She felt like her mind and body were falling apart, and in a way, they were.
And then, of course, the physical ones, those are devastating, because then your hair starts falling out, and you get facial hair growth and acne, and I gained about 70 pounds.
After years of trying to figure out what was wrong, she got the diagnosis, Cushing's disease, a rare hormone disorder caused by a benign tumor on her pituitary gland.
There's just this tiny little piece of a disease that is causing so much trouble.
Dr. Daniel Prevedello, a brain surgeon at the OSU Medical Center, found a way to remove the tumor through Conchetta's nose. This is video from OSU of a procedure called endonasal surgery. It's brain surgery through the nose.
Why we've introduced that device through the nose, we look at the screen, and then we perform the dissection, find the tumor, and remove the tumor that way.
With no incisions and easier, faster recovery for Conchetta.
And then again, I feel like I'm in like water.
And with her tumor out, she can now get back to her career.
Take it easy and really just, let my body recover in its own time. And so acting will come back when I start feeling like I can, stand on a stage without falling off it or something.
So I was wrong. I was saying that's a thyroid disorder. That's a pituitary disorder. And what it causes, hold on. How do I get back to my thing? Oh, here we go. Here we go. So what it is, it's too much secretion from the pituitary gland, which tells your adrenal glands. Your adrenal glands sit on your kidneys. And so the pituitary gland is telling your adrenal gland to put out too much of its hormone. The adrenal gland puts out the hormone called cortisol, which is what's causing all these problems. So too much of the hormone cortisol is what's causing Cushing's syndrome. I got that mixed up. I was saying it's thyroid. It's not. It's a pituitary disorder that causes too much release from the adrenal gland. Remember, the adrenal gland is on top of your kidneys. All these dark cells here, this is a result of, it's called a glucagonoma. And anytime you see oma, that's a cancerous growth. And it's growth of cells in your pancreas that produce glucagon. Who remembers what glucagon does? Raises your blood sugar. So these are the cells in your pancreas, and they're multiplying out of control, putting out a bunch of glucagon. This would cause somebody's blood sugar to be too high. Couple of words you need to know. Hyperglycemia is too much sugar in the blood. Hypoglycemia is too little sugar in the blood. You got to know those terms. They can be caused. Too much sugar in the blood could be caused by a glucagonoma. Too little sugar in the blood could be caused by, say, too much insulin, which causes sugar to be stored. So you can have all sorts of problems. You can also get too little sugar in the blood if you hadn't eaten enough sugar. And you're out of stored sugar. This is gigantism. So we call it gigantism when somebody has a pituitary tumor. Oh, I also got a model of pituitary tumors back here. There we go. That's Robert Wadlow, the tallest person that ever lived.
Wow. He can't dunk.
I'll pass this around too.
He got no game.
This is, of course, human face, and on the back here, this shows where the eye is. That's the eyeball there. And this is the optic nerve that comes from the eye. And you can see it goes right above the pituitary gland. So on the left side here is the normal pituitary gland, and you can set it where it sits so that you can see how the optic nerve comes over on top of the pituitary gland. You can get a tumor on your pituitary gland, which makes the pituitary gland much bigger. That's what this is. And it shows how it'll stretch the optic nerve. And this can cause blindness. That's one of the things that happens to people who have gigantism or have acromegaly, which is the other name of a pituitary tumor. If the pituitary tumor occurs when you're a child, you'll grow really, really tall. That's gigantism. If the pituitary tumor occurs when you're an adult, you won't be able to grow any taller, but you'll get too much growth hormone in your system, and it causes your cartilage to keep growing. Cartilage will continue to grow. Your ears get big, and your nose gets big, and it causes a lot of problems at the ends of your bones. And you can also see where the tumor will grow, and it'll push against the optic nerve and cause it to, you could possibly go blind from it. So I'll pass this around. Doctors have those kind of things in their offices when they're trying to explain to patients what's going on with them. So this guy's the tallest man to ever live. He got the pituitary tumor when he was a kid. Did I already show you all this?
Yeah. Can we see it again?
Making ends meet is certainly a big job when it takes size 39 shoes to fit them. Two into one new boy. Here's the owner, Robert Wadlow of Chicago, who at the ripe old age of 17 stands 8 feet 4 inches in his socks, and incidentally seems to be quite beyond the reach of young women. Every time young Robert goes through a doorway, he scores a duck. And this is Robert's father, a mere dwarf of 6 feet.
Oh my gosh.
Um,
Oh man, that guy's ripped.
Who, Arnold? Oh.
So,
Some black
Yeah, I saw that.
those are some of the disorders. Okay, you can, will you stop filming?